वेलकम बैक टू ड्रीम मेडिसिन। आज की वीडियो में हमारे साथ हैं बहुत ही स्पेशल पर्सन। वो बेसिकली हम आज इंटरव्यू करेंगे डीन सर के साथ में, जो कि डीन है ताशकेंट पीडियाट्रिक मेडिकल इंस्टीट्यूट के। इनसे बेसिकली हम लोग जानेंगे मोस्ट कॉमन क्वेश्चंस के बारे में जो मोस्टली बच्चों के पेरेंट्स के रहते हैं, जो भी MBBS अब्रॉड में या फिर स्पेशली MBBS इन उज़्बेकिस्तान में एडमिशन प्लान करते हैं। तो चलिए स्टार्ट करते हैं आज की वीडियो को उन सभी कॉमन क्वेश्चन से। Sir, basically my first question is that like mostly parents and students in India, they ask like what will be the medium of education?
Thank you very much for your questions. And today, Tashkent Pediatric Medical Institute totally orientated to teach the foreign students in English medium. And also we have prepared the students on general medicine, pediatrician, nursing and fundamental biology direction of the education. So mostly our Indian and other foreign students taking the education in the general medicine program.
Okay, so it's totally English medium.
Yes, this one is totally English medium courses in the program. And also students should take the entrance interview, and they should take some biology, chemistry and psychology medical adaptation knowledge. And for this one we are asking to have some interview about some simple questions.
Okay, understood, sir. Okay, sir, like the next most common question asked by students and parents is like what is the recognition or accreditation of this university? So please can you give a light on this topic?
Yes, today the Tashkent Pediatric Medical Institute has own international accreditation. It's came from World Federation Medical Education, and we had 2 years ago we had the international certificate from WFME, and today 2 hours program is totally fully accredited. This is general medicine,
Okay.
and also pediatrician curriculums, and all the students today coming to know about this accreditation certificate. And also sometimes some universities getting this certificate only in one language.
Okay.
For example, it may be in the Uzbek language, but today we have a full accreditation, full program accreditation. For example, it consists of 3 languages: Uzbek, Russian and English.
Okay, that's great. Okay, sir. So like moving to next question, like many students and parents basically ask like what happens in India. In India, students can practice in hospital or polyclinic for the second year itself.
No.
So is it allowed for international student to practice in polyclinic or hospital to observe and to observe the patients? Is it allowed?
Yes, it's totally allowed, because our governmental program today organized 50% to 50%. What is mean? 50% they are taking the theoretically education in the institute, but 50% they should take in the bed of the patients.
Okay.
It's in the clinics, in the hospitals. They should take the own observership, clinical practice, and even every end of the academic year, each student mandatory should take the summer medical practice during the 1 month.
Okay, that's also mandatory.
Yes, it's a mandatory. If student will not take this clinical 1 month clinical practice, summer practice, they are expelling.
Okay.
So in this case, every time we are asking from the students, foreign students, to learn some local language, Uzbek or Russian. Why? Because our patients not speaking in English mostly.
Correct.
I mean, so in this case they are taking everything, and our some teachers and some clinical mentors, they are going with the students to the patient beds, and they are observing together.
Okay.
So that in the clinical subjects, after the 3rd grade, each groups consists maximum 8 students. Why 8 students? Because they should take some clinical practice 4x1.
Okay.
Why? Because the 4 students can come with one mentor, a clinical mentor to the patient beds.
Okay, so like basically you split this clinical in the 4 students will be there, and one clinical mentor will be there to assist the student during the clinical trials.
Yes.
Okay, and sir, like moving forward to the next question. So the common question is like why students should choose this Tashkent Pediatric over other universities in Uzbekistan or any other university like in other countries? Why should they come to this university?
Because I told you before, because today we already has we had the international accreditation.
Yes.
And this is for us the main important, because we didn't got foreign students before, 2 years before. But other universities, governmental medical universities of Uzbekistan, they are already got foreign students with our international accreditation. So in this case, during the 2 years ago, we got this certificate, and after that, we prepared our educational and clinical basis.
Okay.
I mean about the buildings. Today, we have a campus-orientated university, medical university. In this, in the little district, we have 3 hours of campuses. This is the main administrative educational campus. We say to this campus where we are located here, located our main educational building, 4 floors building, big building, and we have our own simulation center. And you can see other medical universities, they doesn't have they don't have any simulation center, which is a separated building and with total equipped. And you can see that inside we have all the phantom simulators, some other how would say it, robots, where all the students can take the preclinical skills.
Okay, so yes, I visited the campus, and basically your stimulation center has all the equipment, and even they are modern equipment. As compared to other universities, it's very near to the university.
Yes. Other very important things. We have the second campus. In the second campus, we are calling the student campus, where we have all the competitions with the students, some spring, some competitions, and there we have our own academic lyceum and all hostels and lecture halls, and also library. And also we have our third campus we are calling clinical campus. And our clinical campus totally orientated to the pediatric care. But every company is coming to us and asking, this is a pediatric orientated, pediatrician orientated medical education. No, we are telling them our main adult clinics, I mean which is orientated to the general medicine education and internal medicine. This is in the center of the Tashkent, and our basis department, clinical department basis, located in this Republican Internal Diseases and Rehabilitation Center, which is consists more than 600 beds. And here we have a Republican level of the clinical practice. So all the students going this center to take to some education. So otherwise, this is the campus is totally complected with the IT technology. And in each auditoriums, you can see that we have electronic boards and some electronic things, everything in the electronic. And also we are using some cadavers, some electronic, some electronically and some natural things to use the students some practice. And today we have in the chemistry high level laboratories, educational and scientific laboratory and biochemistry laboratories, and you can see all the students taking some laboratories there. So I can continue this one. So in this case, it will be very effective if you will give some other questions.
Yeah, sure. Basically, I also explored your entire campus, and I totally agree with you. Yes, this campus is totally basically having modern infrastructure. It's like they have computerized labs, and we can say this digital board also is there, and like they are also using modern equipments to teach the students. Okay.
Yes.
My basically last question is you like. Basically, in India, it's required. They require 1 year of internship certificate from the university from which student is studying. So, are you guys? So, this university is providing this internship certificate to the Indian students so that they can, when go back to India, they can just get this our NMC approval, or we can say NMC certificate.
Yes, of course. And today, it was a president degree about adaptation hours program for the foreign international programs. So we know, because the Indian NMC totally giving us some requirements.
Yes.
For the getting the medical license in India.
Correct.
So in this case, today our general medicine program adopted to the NMC requirements.
Okay.
One of the very important things, this is in the 6th grade, when the students after the 5 years education, they are going to the clinical practice during the 1 year. So it's equal with the Indian NMC, National Medical Council requirements, which is it's taking like internship. They are not coming to the theoretical department. They are going to the clinic, and from the morning till day, they are taking the totally clinical practice during the 1 year, last like graduation year. So after that, of course, it's already 4 years in Uzbekistan. Who is taking our general medicine program. We are after the graduation, because after the 2 years we will have some graduation students. We will give additional certificate about the 1 year internship equivalent certificate.
Okay, equivalent to 1 year internship in India.
Yes.
Okay. So thank you, sir, for your valuable time. So students, if you have any other question and you want to ask with the sir, you can comment that question in the comment box, and we will ask the sir on your behalf, and then we will get back to you with the answer. So thank you for your valuable time.